Hello, thank you for joining me today. We're going to spend the next few minutes learning about strokes, what they are, how they affect us, and most importantly, how to reduce your risk of having one or having another one. The more you understand, the more power you have to protect your brain. Feel free to pause and jot down any questions you have as we go through the material. You'll be able to talk about them during your follow up call. Let's take a few minutes to go over keywords that come up often. Strokes are also called brain attacks, where the brain doesn't get enough blood flow. Strokes are a major cause of preventable disability in the United States. That means there are things that we can do to lower our chances of having a stroke or having another stroke. There are things we need to be aware of that are severe warnings of a stroke. These are things that we need to take seriously and reach out to our doctors right away. Did you know that stroke is the fifth leading cause of death? Nearly 800,000 people in the United States have a stroke every year. Your risks increase as you get older, which is why this conversation is so important. Strokes are a major cause of preventable disability in the U.S. That means that there are things we can do to lower our chances of having a stroke or having another stroke. More women than men have strokes each year. Our goal is to help you become stroke smart. We want you to be able to reduce stroke risk by understanding what can increase your risk of having a stroke and reducing risk when possible, recognizing stroke symptoms, and being equipped to call 911 for help when you see someone experiencing stroke symptoms. Let's review what is a stroke. The medical term for a stroke is called cerebral vascular accident, or CVA for short. Most people have heard of heart attacks, right? Well, strokes happen when the brain doesn't get enough blood flow. And just like heart attacks, they're serious. The brain can't go without oxygen for very long. Just like heart attacks occur in the heart, the brain can also experience brain attacks. Strokes are just as serious as heart attacks. Respond immediately if you think you or someone else is having a stroke. There are three types of strokes that can occur in the brain: ischemic strokes, hemorrhagic strokes, and transient ischemic attacks. Ischemic strokes are the most common type and happens when a blood clot blocks a blood vessel, cutting off blood flow to parts of the brain. Hemorrhagic strokes occur when a blood vessel in the brain bursts, causing bleeding and damage to brain tissue. Transient ischemic attacks, or TIAs, often are called mini strokes. A TIA is a temporary blockage that clears on its own. While symptoms go away quickly, it is a warning sign of a possible future stroke. Let's talk more about TIAs and break down what occurs. TIAs is often called a mini stroke or a warning stroke. It happens when there's a temporary blockage of a blood vessel in the brain, usually by a clot. Even though the symptoms may disappear in minutes and without medical intervention, a TIA is a severe warning. It is your brain's way of saying, "Help me before something worse happens." This is something we need to take very seriously and reach out to your doctor right away. TIAs are often brief, even just a minute or two or up to 5 minutes, but they need to be taken very seriously. So, how do you know if you're having a TIA? Symptoms of a TIA include sudden headache without a cause, weakness of face, arms, or legs, especially on one side of the body, vision becoming blurry suddenly, difficult speaking, dizziness, loss of balance, and coordination. Let's take a look at ischemic strokes. Ischemic strokes happen when blood vessels in the brain are partially or fully blocked by blood clots. Clots make it harder for blood to get to the brain. Ischemic strokes are classified by two different categories: thrombotic or embolic. Thrombotic strokes occur when blood clots block one of the arteries that supply blood to the brain. Embolic strokes occur when a blood clot forms somewhere in the body and travels to the brain. Another stroke is a hemorrhagic stroke, also known as a brain bleed. This occurs when a blood vessel in your brain suddenly ruptures and begins to bleed. There are two types of hemorrhagic strokes. One including intracerebral hemorrhaging, which occurs when a small blood vessel inside the brain breaks, leading to bleeding on the brain. This hemorrhage is the second most common cause of a stroke, and it is the most fatal. Another type of hemorrhagic stroke is called a subarachnoid hemorrhage. This occurs when a blood vessel bursts and there is bleeding between brain tissue and the skull. Let's take a minute to pause and review the material that we covered. Do you remember the difference between a TIA and a stroke? How many types of strokes are there? How are they different? Let's go over some stroke risk factors that can be changed versus those that cannot be changed. The ones that can be changed includes high blood pressure, smoking or drug use, high cholesterol, diabetes, drinking too much alcohol, and heart disease. Making small changes can make a huge difference. Talk to your doctor about making these changes to help prevent a future stroke. Some stroke risk factors that you cannot change includes age. As you get older, your risk of having a stroke goes up. You're more likely to have another stroke if you have a stroke or a TIA in the past. As I stated before, women are more likely to have a stroke than men. Black and Hispanic women are more likely to have a stroke than white women. The same difference was not seen in men. Let's pause here and ask a few important questions. Do you know the symptoms of a stroke? If someone near was having one, what would you do? Think about that for a moment. We'll cover this next so you'll feel more confident. Common stroke symptoms a person might experience includes trouble speaking or understanding others' speech, difficulty seeing with one or both eyes, sudden unexplainable headaches, dizziness or trouble walking, a sudden loss of balance and coordination, weakness or numbness in the face, arm, or leg, especially on one side. Now that we know stroke risk factors, let's go over how to spot signs of a stroke. So when spotting signs of a stroke, we want you to use the acronym BFAST. BFAST stands for balance, eyes, face, arms, speech, and time. Is there a sudden loss of balance? Is there a sudden loss or change in vision? Does the person's face look uneven? Does one arm hang down? Ask the person to raise their arms. Does their speech sound strange or different? And T is for time. Time is key during a stroke because brain cells start to die within seconds. If you or someone else is experiencing any symptoms of a stroke, call 911 immediately. Some stroke treatments only work if given within the first few hours. Waiting too long can cause more brain cells to die. That is why it's so important to call 911 right away. After being admitted into the hospital after a suspected stroke, various tests will be given to determine the type of stroke and where the stroke occurred. This will ensure that the appropriate treatment plan is followed. These tests may take pictures of the brain and show the flow of blood through the vessels of the brain. How do doctors choose the best treatment following a stroke diagnosis? Well, that is based on several factors, including how long it has been since the stroke started, the type of stroke, the patient's overall health. Treatment includes imaging and neurological exams to identify the stroke and the severity of the stroke. The treatment types include medicine that breaks up blood clots or thin the blood, surgeries to remove blockage or restore blood flow. During your hospital stay, doctors will typically order other procedures to be done while you're being treated for a stroke. These procedures include blood tests to check your organs, kidney functions, and blood sugar levels. They may also insert an IV line to give you fluid and other medications. They often will complete an electrocardiogram or EKG to check your heart rhythms. Carotid artery is a major blood vessel in the neck that supplies blood to the brain. One of the stroke risk factors is carotid artery disease. After a TIA or a mini stroke, a carotid endarterectomy is completed. This is a procedure that removes plaque from the carotid artery, allowing more blood flow from the neck to the brain. This surgery takes around 1 to 2 hours to complete, with a hospital stay of 1 to 2 days. Post surgery, you will experience some of the following symptoms, including having trouble swallowing or feel soreness in your neck. The doctor will also put you on a special diet where you can only eat soft foods for a few days. Carotid endarterectomy is performed on an estimated of 150,000 people yearly, with 45,000 of those people in the United States. The host of The Price is Right received a carotid endarterectomy in 1999, allowing him to live for an additional 24 years to the beautiful age of 99. Let's talk about discharge after a stroke. The length of stay following a stroke depends on the severity of the stroke, physical impairments, medical status, and if you need ongoing therapy assistance. When you leave the hospital, you may go to an inpatient rehab, skilled nursing facility, or even home, depending on your medical needs. Let's take a few minutes to watch an
Hello, in this
overview of
health
a
sketch
stroke.
we want to talk to you about stroke. It's a bit of an odd name, stroke. It certainly has nothing to do with tennis strokes, swimming strokes, or brush strokes. The word stroke comes from the idea of receiving a strike or blow, as that is how quickly strokes appear. All of a sudden, people are struck by this illness. Did you know that every year more than 15 million people worldwide have a stroke? Of these, 5 million die and another 5 million are left disabled. Whilst most strokes occur in people over the age of 65, they can occur in much younger people too. But what exactly is a stroke? The brain, like all parts of the body, needs oxygen, which it gets from the blood. A stroke happens when blood flow to the brain is cut off. When brain cells are starved of oxygen, they become damaged, and the symptoms that follow are called a stroke. As the brain controls the whole body, the symptoms of a stroke can be wide-ranging, depending on which parts of the brain are affected. If the stroke occurs here, it would cause a drooping face. Here, weakness in the arms or legs. Or here, difficulty speaking. Other symptoms can happen too, like changes to vision, loss of balance, confusion, and memory loss. The effects might be barely noticeable, but are more often severe and disabling. Sometimes these changes can be reversed if treatment is started early. That's why it is so important to act quickly if you suspect a stroke. Remember, you need to get help fast. F is for face. Is their face drooping on one side? Can they smile? A is for arms. Is there weakness in the arms? Can they lift them both up? S is for speech. Is their speech slurred? T is for time. If you spot any one of these signs, then it's time to call an ambulance. Once the ambulance arrives at the hospital, a doctor will assess you and arrange an urgent scan of the head, which shows where the brain is damaged and what type of stroke has happened. Strokes are put into two groups depending on the problem in the blood vessels supplying the brain. There can either be a blockage, called an ischemic stroke, or a bleed, called a hemorrhagic stroke. The majority of strokes are blockages. It's important to identify early on which sort of stroke has happened, as they each have very different treatments. Blockage strokes are commonly caused by the buildup of fatty material in blood vessels. This fatty buildup may lead to a clot, which blocks the blood supply, just like in a heart attack. This is why a stroke can be thought of as a brain attack. A clot may occur within the brain, or it can travel from another part of the body, commonly the blood vessels in the neck. Clots can also travel from the heart, which may happen when you have an irregular heartbeat called atrial fibrillation, or AF. If a blockage stroke is detected within the first few hours, a clot-busting medication is sometimes given to dissolve the clot. This is called thrombolysis. If thrombolysis can't be used, other medications such as aspirin will be given as treatment instead. Bleeding strokes happen when a blood vessel bursts suddenly, causing blood to leak in or around the brain. In these strokes, blood on the brain can lead to swelling, a serious problem which may require surgery in some cases. Sometimes, stroke symptoms completely disappear in less than 24 hours. This is called a mini-stroke, or TIA. Often, symptoms only last a few minutes, but just like with a full-blown stroke, you must go to hospital immediately if you suspect a TIA. This is because a TIA is a warning sign that you're at high risk of having a full stroke. Whether you have a TIA or a full stroke, daily medications are started and continued lifelong to help prevent further episodes. The effects of a stroke can be disabling, but given time, the brain can slowly adapt to recover some previously lost abilities. This is why stroke rehabilitation is so important. Rehab can be challenging, but many specialists are on hand to help alongside doctors and nurses. If your stroke causes difficulty swallowing, dietitians can recommend special diets or feeding tubes. If you have problems with communication, speech and language therapists can help. If it has become difficult to walk or perform daily tasks, physiotherapists and occupational therapists can offer exercises and home adaptations. Also, after a stroke, people often feel low or frustrated that they can't do the things they used to, and don't like being dependent on others. Counselors can help talk through these feelings, and many patient groups are available for further support. We've talked a lot about strokes, but what can we do to prevent them from happening? Even if you've already had a stroke in the past, there are many small steps we can all take to reduce our future risk of having a stroke, such as lowering high blood pressure, the #1 cause of stroke, stopping smoking, lowering cholesterol, being more active, eating healthily, lowering alcohol intake to within recommended limits. If you have diabetes, keeping good control of blood sugar levels. In this health sketch, we've talked about what a stroke is, how to spot the key symptoms, and the need to act fast. We've also talked about treatments, rehab, and the steps we can take to prevent strokes. We hope this health sketch about stroke has been helpful for you and those around you. Health sketch, health for all to see.
Let's remember to always be fast. You want to look at balance, face, arms, speech, time. Always act quickly and call 911 if you believe you or someone else is having a stroke. This brings us to the end of the first session. Thank you so much for your attention and time. Please write down any questions that you have so that we can discuss them at your follow-up call. Thank you.